Hello, I'm gynecologist Dr. Javier Saldaña, and these are some of the aesthetic genital surgeries available at Vida. Let's start with the most popular one, labiaplasty of the labia minora. There are two labia minoras, the left side and the right side. There are many different sizes and shapes of one or both sides of the labia minora. The surgery object is to remove excessive tissue of one or both sides of the labia minora to reduce the size or modify the shape of each labia minora. Another aesthetic genital surgery is ectomy or removal of excessive tissue surrounding or covering the clitoris. Another surgery is perineoplasty. The perineum is the area between the vaginal opening and the anus. Here is where obstetricians do the episiotomy during a vaginal delivery to help the baby come out. Also, it is here where to find some of the important muscles involved in the vaginal relaxation syndrome. Another aesthetic genital surgery is labiaplasty of the outer labia or labia minora. Like the labia minora, there are two sides, left side and right side. They are located in the most external and lateral part of the vulva. We can either remove excessive tissue or we can fill them up to give that padded sensation of fluid. Most of these procedures are ambulatory surgeries and may require 6 to 12 hours or in some cases 24 hours of hospitalization before getting discharged from the clinic. Most of them can be performed individually or in combination with other surgeries from other parts of the body. For more information, contact us at Vida Wellness and Beauty. Thank you for your interest.